effects do microbial wound dressings have on mature biofilms grown? And they grow them on pigs, because that's as close to the skin of people as there is our pigs. And it says that most microbial wound dressings can reduce mature biofilms by 1 log, or 90%, or 2 logs, 99%, except for cadexamer iodine. Cadexamer iodine reduces it 99.9%. So if any of you use cadexamer iodine, that's a really good topical product to use after particularly a sharp debridement, something like this. And you want to be sure you do something every 3 days. When we look at our assessment for our bacterial burden, and when we think about, well, we already talked about, okay, so here, this bullet here, cultures and tissue biopsy help identify which bacteria is growing, and what you want to underline even more is to target specifically with antibiotics, the right drug for the right bug for the right patient. We're not going to give people broad spectrum antibiotics anymore in general. And we have new testing technology to help you figure out what is the right drug for the right bug. What you can do in the meantime as clinicians in this room, what you can do is you can use NERDS and Stoney. Dr. Gary Sybil, he's out of Canada, a wonderful man, great sense of humor, and a phenomenal teacher and mentor and writer in wound care, and he teaches all over the world. Dr. Sybil came up, and he loves to do mnemonics and acronyms. He's crazy making about it. So he came up with NERDS and Stoney's, NERDS and Stoney's. If you have, now listen to this, this is for all the clinicians in the wound room that are doing wound care, and you're looking at that wound, and you're looking at this patient. If the person has 3 or more NERDS, then you probably should treat topically. If they have 3 or more Stoney's, then you should probably treat systemically. So topically means the wound's not healing, so it's stalled. It's exudating more. You have red or bleeding granulation tissue, friable granulation tissue. Debris is your dead tissue. It's your slough, your eschar, or anything else that doesn't belong in that wound. And the smell increases. You have 3 of these, you should probably do some type of a topical antimicrobial or maybe a topical antiseptic. You don't need to go systemic at this point. However, if you have 3 or more of these where the wound is getting bigger, the size is increasing, the wound is hotter than an area near it, and most of us don't have dermal thermometers, but that may be coming. You can probe to bone. What happens if we probe to bone? What do we think is going on? Probably osteomyelitis, absolutely. Now look at this. How many times have you seen, you've got a wound right here. You come back, your next dressing change, and there's another little wound right over here on the side. You ever seen that? That's your biofilm spreading perivascularly. That's what those new lesions are. So you want to be very, very careful. If nothing's changed and it doesn't have to do with pressure, as for a pressure injury, then that's what's happening is your infection is spreading perivascularly. Your exudate has increased, redness has increased, swelling has increased, and the smell increases. 3 or more of these, then you probably need to treat systemically.